Qualities of skeletal muscle. Okay, excitability. The ability of a muscle to respond to stimulus, also called irritability, typically comes from the nervous system, usually a wave of stimulation along the entire length of the muscle. Excitability, that's how we find a motor point. That's the most excitable part of the muscle. Contractility, known as activity or action, refers to the muscle's ability to generate a pulling or tension force. So if we have a short, tight muscle, it's lost a lot of contractility because it's already stuck in a short position. When we release it with the motor point, it increases contractility, which is strength. So you're going to see people hitting new records and lifts and things like that when you're working with someone who's had chronically tight muscles. Extensibility. So that's the ability to lengthen as a consequence, generate force over a range of lengths. The way, here, bicep contracts and shortens, however, as the elbow extends, the muscle can still stay contracted. So all of that extensibility is like if you do a curl and you're slowly lowering the weight, the muscle's still contracted as it's stretching. So that's a different thing from contractility. Contractility just brings the weight up, it shortens the muscle. But extensibility, you're still contracted and stretching the muscle at the same time. So it's a different dynamic of the muscle. But I believe all of these things improve by treating motor points of the muscle. Elasticity is one of the most important ones. Simply describes muscle's ability to return to its original shape and length. So over time we have muscle shortening, it's lost elasticity. The motor point is going to restore muscle elasticity, which is why you're going to improve the range of motion of the joint. This is why when you have a joint pain and you treat the muscles that cross the joint, the pain goes away because you've taken tension off of the short, tight muscles, which now allows the joint to work properly without friction and anything that would cause pain. Or you improve the centration of the joint. So the way the muscles contract, there's calcium from the sarcoplasmic reticulum in the muscle cells. There's a reuptake of calcium from the sarcoplasmic reticulum. Injury to a muscle cell can leave calcium in the muscle fibers. Accumulation of tight muscle fibers leads to muscle shortening. Acetylcholine causes depolarization of the muscle cell wall, leading to contraction. So all of these dynamics are how the muscle gets injured in short. They think that a muscle replaces itself every 10 to 15 years. But I would just say, except for trigger points, because if it did replace every 10 or 15 years, I think you could wait long enough that a trigger point would go away, and it just won't go away. It's not going away. If you treat somebody, they've had an injury 20 years ago, it's still there. Electric stimulation of motor points restores elasticity, extensibility, contractility, excitability. Dry needling of active trigger points, deactivate the pain, restore joint function by releasing taut bands. And so just, I know that the term dry needling is a sensitive one. All I'm going to say is I use it because I believe we need to own it and not allow people to appropriate the term to mean any kind of acupuncture that they want to do. Because dry needling is a specific treatment of taut bands in the muscle. That's all it is. It was what Carl Levitt was doing, it's what Janet Travell was studying, and it has nothing to do with putting a needle into any other part of the body for any other purpose, except that it's not under your license. It's completely different. So I really think it's important for us to redefine for people the real term and what it's used for, and not allow people to do any kind of acupuncture they want and call it dry needling so that their license will allow them to do it when they're not an acupuncturist. So that's my take. If you hate the term, you can absolutely call it trigger point release. You can call it trigger point acupuncture. You can call it Ashur needling if that makes you happy. If your patient population loves to hear Ashur, call it that. They're still gonna scream. So, no, but I'm just saying, use it if you like. Don't use it if you don't like. I use it because I think it's important that I, as an acupuncturist, use it. And I guarantee you there will be a day when acupuncturists will be pointing at me and saying, he's been doing dry needling all this time, it's acupuncture. And they're going to, because they're going to, other professions are going to say, acupuncturists can't do dry needling, acupuncturists don't do dry needling, they do something else. They're going to say, well, Rich Hazel has been doing dry needling all this time, so how are you going to say it's not acupuncture?